discussion. The long and short, I'm going to have the chance to speak again, so let me not be too long. The long and short was two things came out of it. And the first was the Accra Compact. And the Accra Compact targeted mainly three things. One, to promote health sovereignty. And the second was how to reform the global health system. And the third was how we can foster sustainable funding for healthcare. And so that was the crux of the Accra Compact. But apart from that, there was also the Accra Reset, which is what you see here. And Accra Reset is broader. President Obasanjo handed the responsibility to me because I'm the champion of African financial institutions, and said that this, in a way, falls within your remit to decide how we're going to restructure the world governance system, especially considering that the old models are going out of date. Multilateralism is coming into an end, and so you must add this to the responsibility. And so we're happy that we have the opportunity on the sidelines of the UN to further the conversations that we started in Accra. And I want to thank all of you who have found time to join us to come and contribute your ideas, to be able to look forward into the future and see what models we can adopt going forward. A lot of responsibility rests on the shoulders of Africa itself. We need a reset in our countries. In Ghana, we have started our resets. And the reset focuses on the fact that we can rechannel resources into areas of priority. And I'll give just one example. I'll say it later in my speech. We have a national health insurance levy, and the levy funds the National Health Insurance Scheme. And more than 18 million Ghanaians have National Health Insurance card that allow them access to free health care at the point of service. They pay a little annual premium. Now, the government before capped this fund, all statutory funds actually. And so if monies coming into the statutory funds exceeded a certain level, the excess went into the consolidated fund. And the consolidated fund is used for all kinds of things: consumption, goods and services, salaries and wages, and all that. And so one of the first things we did, noticing the shortage of funding for healthcare, was to just uncap the fund. And when we uncapped the fund, it resulted in additional revenue into the National Health Insurance Scheme of 350 billion Ghana cedis. No, 3.5 billion Ghana cedis, which in dollars, let's put it in US dollars, will come to about $300 million. You can imagine what $300 million can do. And so immediately from $300 million, we're able to cover the USAID gap in funding, so that the programs that we were funding through USAID could continue. And so there's a kind of innovative thinking that we need to do, and a lot of that depends on us as leaders to be able to look at how we can move resources from other areas that are not priority into areas that are priority and have tangible benefits for our people. Like I said, I still have an opportunity to speak. I'll leave it here. Adam, thank you very much. And I hope Baba Olusegun Obasanjo arrives anytime soon. Thank you.
Thank you very much, Your Excellency. We're going to do a slight modification on the program as we get President Obasanjo here. So I would like for us to, because this was going to come after the welcome remarks, so since the President has spoken about the reset, I want to give us a perspective of what this reset involves. So, with your permission.
is in peril. Climate shocks, pandemics, debt pressures, and moral panic are testing every society. The global order is fraying, and with it, the model of international development we relied on. For decades, we set targets and talked about sustainability. From the MDGs to the SDGs, we've aimed high, yet progress fell short. It's time to find our rhythm, rebuild trust, and move from promises to practice. From Accra to New York, a coalition of leaders, thinkers, and doers are reorganizing the foundations of development. This reset begins with global health. 3 shifts: the mindset shift, the focus shift, and the reality shift. Health is not a cost center, it is a multiplier, an engine for prosperity, agency, and resilience. When health systems are designed as strategic assets, every dollar circulates, strengthening workforces, catalyzing industries, expanding trade, and building true sovereignty. That is why leaders meeting in Accra called for a reset of development itself, with health as the anchor. In New York, we carry that spirit forward. The Accra Reset drives 3 pivots relentlessly. From endless targets to workable business models, from forced consensus to enlightened mutual interest, and from low-trust stalemates to co-creation and joint investment. Leadership matters. The Emerging Club of Accra will set the pace. A presidential council and a global college of advisors convened as an eminent panel to craft a blueprint beyond 2030. This blueprint moves us from a limits of growth mindset to pivots of growth, planet-positive sectors, biodiversity, climate, food, skills, and health, powering inclusive prosperity. Prototypes are already moving. A new health governance architecture, 4D platforms like Proper for supply chains, AfterHub for trade, and Panabios for digital health, BioNovak to accelerate biotech, and the Sustain framework for fiscal resilience. The vision is practical. Our capability model to sustain gains, risk-sharing tools to defend them, and new infrastructure to grow them. Using multiplier indices and synergy maps, the Accra Reset directs every new dollar to where it multiplies impact. Friends, we're not talking about wish lists, we're talking about delivery under stress. About mobilizing billions and channeling them to the pivots of growth. From hospital wards to factory floors, from labs to logistics hubs, we will build systems that last. Today, at the United Nations General Assembly, the Accra Reset launches a coalition of the willing, starting with health and reaching across development. Here is what those shifts mean in practice. Mindset. See health not as a bill to be paid, but as a platform that powers everything else. Focus. Move from counting activities to unlocking outcomes, jobs, learning, dignity. Reality. Trade vague pledges for bankable models with clear incentives and shared risk. Picture this: a district hospital linked to manufacturers through smarter procurement, community health workers with digital tools, trade corridors moving essential supplies faster and cheaper. The result is more resilience when shocks hit and more opportunity every day. Work starts locally and scales fast. Cities and districts pilot. Countries and partners scale what works. Workability is the name of the game. Investors bring patient capital. Innovators test 4D platforms. Governments track multipliers, not just line items. This collision is open by design. African, Asian, Caribbean, Latin American, and global institutions moving with purpose. We honor what came before and build what must come next. The task is immense, but the opportunity is greater. Join us to reimagine development for a turbulent world. Join us to build the Club of Accra. Join us as we turn health into a multiplier of prosperity, equity, and hope, resetting development itself along the way.
From the Club of Rome to the Club of Accra, 60 years ago. I do have the singular honor of inviting the Director General of WTO, who just came in time to deliver her remarks. Should we go ahead and play the video instead? Since you're here.
Okay.
She had given us a video just in case she was going to be late, but since we have her in person, we might as well.
Thank you so much. I think my video may be better than me at this stage. Excellencies, but I just came from an event with the Premier of China where he made an announcement about their willingness to reform at WTO by renouncing access to special and differential treatment. I know it's very geeky, but what it means is that China is really saying it's not going to be struggling with the other developing countries to have access to special treatment at the WTO. And this had been a big bone of contention for our reform, and they just announced that. So I'm a little breathless. So forgive me. But Excellencies, President Mahama, President Olusegun Obasanjo, I don't know if he's here, co-conveners of the Accra Reset. I see many dignitaries, heads of state, Excellencies. It's an honor to be here in such illustrious company to address new and long-standing challenges to development, including health security for people around the world. And I kind of feel that my brother, Dr. Tedros, should be the one up here talking, but let me start. I want to start by congratulating the co-conveners for this great initiative. It's exciting. We all know that global health financing is under enormous pressure. Development assistance for health this year will be 14 to 29% lower than 2024, according to the OECD, returning it to levels last seen in the mid-2000s. Given ODA's importance in some countries' health systems, one might think that the case for a reset is simply because the money is no longer there. But in reality, it goes well beyond that. The fact is that domestic health financing was always too important to be outsourced to outsiders. Mobilizing domestic resources has always been critical. During my tenure as finance minister in President Obasanjo's administration, we treated aid as below the line in budgeting balance, with health expenditures coming from our own resources. At the same time, there are some global public goods like pandemic preparedness, routine vaccination, basic research that the whole world should be financing. For traditional donors, supporting these areas is a matter of longer-term self-interest. It's not about helping others. It's in their self-interest to finance these things. But we should also think about creative mechanisms for developing countries to contribute proportionate to their means. As Director General of the WTO, I want to point to 3 ways in which trade matters, because many people say, what on earth is trade doing with health financing? But it matters for the health reset and for the Club of Accra's wider workability agenda. First, because trade offers a path for countries to raise productivity, boost growth, and earn export revenue, and in the process, make it easier to meet health financing needs. WTO economists estimate that between 1995 and 2020, trade costs reductions boosted low-income economies' GDP by 33%. That means a lot more fiscal space to fund resilient and effective health systems. Second, because in a crisis, open and smoothly flowing trade is a vital means for producing medical goods and services and getting them to people in need. During COVID-19, trade in face masks nearly quintupled. Vaccines were manufactured at scale in supply chains, cutting through as many as 19 countries. But then the pandemic also exposed vulnerabilities. We know that Africa was at the end of the queue and didn't receive the vaccines when it should. because pharmaceutical manufacturing capacity in Africa was lacking. And these are some of the things that we must now take care of, which I hope that the Accra Reset will take on as part of his agenda. And we all know that my brother, Dr. Tedros, has already launched quite an initiative of which we are also supporting at the WTO on these issues. This brings me to my third point, which is that building workable manufacturing capacity on the continent will demand cooperation on trade regionally and globally to lower barriers to key inputs, align standards and regulations, and streamline border procedures so that regional value chains can operate efficiently. This matters beyond supply security and resilience. The idea that vaccines, diagnostics, and therapeutics are being made primarily in Africa for Africans might help push back against the dangerous rise of vaccine skepticism that we see increasing online and in social media. Whether we think of it as a reset or a repositioning, the time to act is now. And that's why I'm excited about this initiative. So let me conclude, Excellencies, by saying we wish you the best. We're here to support you. We want you to succeed. And this could not be more timely. Thank you.
So now that the case has been made for the need for a reset, I'd like to invite a distinguished panel to let us unpack a little bit about what this reset would look like. And so I'd like to call El C, who was originally scheduled to give remarks about Accra, but since our president has done that job very well, I'd like to invite you on the panel. I'd like to invite His Excellency Dr. Tedros as well. Dr. Tedros representing the Global Multilateral, yourself, academia, and then Mia Motley, who is still on the way, the president of Barbados, is not yet here. I would like to invite, I believe we have it's Dr. Tedros, yes, El C, yes, onto the panel, please. Please, it's free seating. Oh, okay. All right, so we cannot. Okay, I've been told that this is a manual, so we need two. We were going to have Mia Motley, who is not here yet. So maybe we'll volunteer Dr. Obi or Winnie. Okay, so we'll bring Winnie in, and then we'll come back to you later. Okay, but that gives us two multilaterals. But please, so Winnie. So, we're trying hard to avoid speeches in this event, except for the keynote, because we want this to be a co-creation. We want it to be conversational, and we want to take away all inhibitions, right? So, I'm going to start with Winnie, who we managed to get on the spot. Given that she's a very prolific speaker. So, Winnie, you've heard that the case has been made for a reset. Is it time? Microphone? Yeah. Yeah. Microphone on the back, excuse me. Right over here. There you go. Okay. So the case has been made for why we need a reset. And given where you sit at UNAIDS, you have a helicopter view of what has happened before. And all the things that we cannot carry post-2030. Can you paint a picture of us as to what is on your mind with regards to what post-20 could look like and what we should be doing?
Thank you for putting me on the spot. I want to say first, Excellencies, distinguished gentlemen and ladies here, it's an honor to be here. I start by congratulating President Mahama on the Accra reset. And the case is made, as you've said. And, I mean, how can it be that we were there during COVID, strangled by debt, paying back debt, and not paying for our people's health? And that today 2 out of 3 countries are paying more, several times more, to debt repayments than to the health of our people. The system isn't working for us. So I think of 3 areas, 3 lessons from the HIV response, 30 years of global solidarity fighting this disease that has no cure, no vaccine. I can think of 3 things that we need to carry forward in that reset that would be important lessons to take forward. The scaffolding is coming down. My sister Ngozi has said it. The ODA that was anchoring the global health architecture is going away very fast. So we must put something back as fast. But that must be strong and enduring into the future. Here are 3 things. 1, at the height of the AIDS pandemic, people came together. There was antiretrovirals saving lives in the north, but 12 million Africans died waiting for the price to come down. Out of that came some solution, a solution of tiered pricing that enables today someone in Ouagadougou to have the same pills to stay alive as someone in New York. That system of tiered pricing, of making generics, is there. But it isn't guaranteed for every new innovation which comes. We need to move it into the future, making sure that whenever there's a new innovation, it is rewarded in such a way that we can multiply it and give it to everybody, so that people don't die when a life-saving medicine is there. So that's 1. We know how to do it. It's not a perfect system, but we can take it into the future. The second is that we took services, prevention, treatment, diagnostics out of hospitals into communities. That's part of the success of HIV. That today millions of people around the world in their communities deliver services to themselves in dignity. Putting communities at the center of a new global health architecture is critical for success. So much can come out of clinics and be in people's hands, and you can save lives. That's the second thing. The third one is that in HIV, having no vaccine and no cure, to succeed, we had to address the social determinants of health. And that's why we use a multi-sectoral approach to fight AIDS. It can't be a pill is not a bullet, but you have to remove the social barriers. And that has underpinned the success. So going into the future again, we must move away from a curative approach to a preventive approach that brings all sectors of government together to give people health. Those are the 3 I think we must take forward.
Brilliant. We had originally reserved this seat for a political person because we wanted a multilateral political and government. I forgot that Whitney is also political, so she spoke well to address the 2 issues. Since you mentioned global governance, and it's clear that you cannot have a global system working when a local system is not working, because the global system is an amalgamation of the local governance systems that are working. I always tell people that you can integrate 55 countries in Africa if you can integrate departments, ministries, and agencies within one country. So, Minister, Ghana clearly is one of the pace setters in leading this discussion or thought leadership around a governance of a reimagined global architecture. What does reset mean to you in practice in Ghana, especially in the back of this defunding that has happened? Thank you.
Thank you very much, Edem. This is how we see reset in Ghana. Reset means domestic resource mobilization. Reset means doing the right investment in the sector. That investment must respond to the needs of the people. Reset means sustainability. And reset does not mean isolation. You know, before I became minister responsible for health, I was a member of parliament, and I'm still a member of parliament anyway, from a rural constituency. And so I appreciate that when that small child in the village gets vaccinated at the right time, when that pregnant woman in the village gets the insecticide-treated net. See, in Ghana, we have the highest political will when it comes to research because it's being led by the president himself. And as he has already indicated, one of the major reforms he made in the country was to uncap the national health insurance. And what is very interesting about uncapping the national health insurance is that that revenue, that money, that 300 million he made mention of, was used where it's needed most. And so today in Ghana, we are rolling out free primary health care. We know that cost is a barrier to primary health care. In order to achieve the universal health coverage, in order to do the right screenings on time, in order to detect the diseases at their early stages, we are talking about NCDs. We have to remove the financial barrier with respect to primary health care. Another very interesting thing that is happening in Ghana is that we are supporting specialist care, specialist level care. And you hear funds like Ghana Medical Trust Fund, popularly known as Mahama Cares, named after our president. And this is dedicated towards the funding of specialist care. You know, and so these are major reforms that we are undertaking in Ghana. And the most interesting aspect, whether the national health insurance or the Mahama Cares, these are domestic mobilization of resources. And therefore, we have absolute control and nobody dictates for us how to spend the money. And you see that we are using the money for the right purpose. His Excellency, the President, is determined to make Ghana a pharmaceutical hub. And in fact, to even make it a hub for the production of vaccines. We learned through the bitter way during the COVID pandemic. We want to avoid a situation where a country will determine when we get vaccines in Ghana. So this is what the reset means. But you see, in all this, it makes sense to the Kenyan in Kisumu, the Togolese in Lome, the Ghanaian in Wa, when that person has quality health care, finito, irrespective of the person's location, irrespective of the person's status in society, irrespective of how much the person earns. And we must do the right investment for the right dividend. And I think that along the process, we may need partnership. But that partnership must make sense. That partnership must not come with prescriptions. I thank you for the opportunity.
Thank you. Thank you so much. So in the spirit of partnership, Dr. Tedros, it's clear that the world's youngest population now cannot depend on loans and grants to sustain the kind of innovation aspirations they have. So we have to forge partnerships. At WHO that you lead, and health has been the most dependent on global aid. What's your vision and what do you see from the helicopter view where you sit that we should be doing to forge the kind of partnerships necessary to make this reset work? Because it certainly cannot be business as usual.
Yeah, thank you. I think my two fellow panelists have said many of the key things. Even when you talk about partnership, I don't think it will, be seen from the angles that the minister had said, and also what Winnie said. think the current times we're in, difficult times, probably painful as well, because as you know, in WHO, many were interested to know how we're doing. The difficult process we're passing through, and big part very, very painful. Because when I say painful, we're sending off our colleagues who have been working very hard under serious stress during COVID, and now they don't deserve this. So that pains me. But at the same time, we see that during these difficult times, there is opportunity. Opportunity to reset the organization. And opportunity to change. So the partnership should also be shaped by new thinking. But something that has to be at the center, whether it's partnership or other things, is what our continent needs. It's a mindset issue. I really enjoyed the video earlier. It's about mindset. I think we need to have a can-do attitude. We need to have an attitude of self-reliance. To be honest, it's time to reflect. Meaning, we have our own problems, especially the mindset of aid dependency. Cleaning is from inside out, right? Before you talk about partnership, I think internally we need to clean what's wrong. So one is the aid dependency mindset that has to change. But at the same time, then when it comes to the partnership, our partners should also change their mindset. When, for instance, we say Africa doesn't need charity, it needs fair terms, then our partners should have a mindset of creating the right terms. I think my sister Ngozi can say more on this, whether it's trade or investment or whatever. I think the right terms will be very important. So for whatever we want to achieve, we aspire to achieve, or for the partnership to succeed, I think what is important is first the honest reflection ourselves and clean our problem, and second the change of mindset we expect also from partners, which is, as I said, we need the equal terms. Otherwise, I don't think we need the aid, actually. For instance, there were some figures I was reading. Africa loses $90 billion in 2023, actually, to illicit financing, while it gets $74 billion in aid. But in the illicit financing, what happens. It's two to tango. So there is a share of our own problem and a share of also other players. So I see a better future. To be honest, there is a challenge if we can use it properly. So, and I see many things going in the right direction. Many leaders I have met are saying exactly the same. It's time now. We need to have a mindset change. And the example that President Mahama gave us earlier is very important, the $300 million to cover the USAID funding gaps. And then the minister said we should focus on domestic resource mobilization, and there is the means. We were even discussing about it when I was in Accra last time. The immediate could be raising taxes on alcohol and tobacco, but the long term would be what President Mahama said, to strengthen the insurance system further, that we can mobilize resources And then the second from partners, I would give the best example was when Gordon Brown was Prime Minister and I was Minister of Health and I was a member of his committee. The mindset from partners' side that he promised one plan, one budget, one report, and there was the same compact we signed then. And I remember the first compact signed in Ethiopia generated a lot of money. Not only that, it was in one basket, all donors using that one basket, except one donor. Maybe you'll guess who that would be. And the investment in strengthening the health systems, starting from primary health care, was from that one plan, one budget, one report. So leaders can do exactly like what Gordon Brown started some years ago. The reason I'm bringing this as an example, though, is if you talk about partnership, then the other side can help. And instead of giving aid, which could be giving fish today, but the support that comes is used in capacity building, which is exactly the same principle we have agreed when the compact was signed. I think with this, we have a better future. But the key for me is forget the rest. It's a mindset issue. Are we really ready to confront our own problems? And are we really serious when we talk about self-reliance? And are we really to act? The word is, everybody says it, but are we ready to act and march forward? Thank you. And
well, thank you so much on that very, very inspiring but hopeful note. Given that you all have very competing interests, we're going to draw the curtains on this lightning round of fire chat. Like, once again, a round of applause to Dr. Winnie, Dr. Tedros, and Honorable Minister of Health. We must have we do have President Obasanjo in our midst now, so we can bring our podium back. And we'll proceed now into the solidarity messages ahead of the keynote. I must also acknowledge that this partnership is a co-creation partnership. So we have foreign ministers of Brazil, India that have joined virtually. We have Prime Minister of Barbados is not here yet, or is she? We do have Kenya, who is represented. The President of Kenya is represented by the Minister, the CS of Health, Botswana. And as you see on the logos, there are quite a number of countries that have already joined this research agenda. And of course, with a motley number of collection of private sector leaders, because we are saying that this new development model can no longer be driven by philanthropy and handouts. It has to be driven by business models. And so we do have CEOs of companies that are here that we'll be introducing as we go along. And I'm happy to see Ike from Access Bank, among others. We had CD from ADB here earlier. So now I'd like to invite Baba, who we affectionately call Baba. Baba, you missed the first part, but President Mahama was gracious enough to welcome us on your behalf. And so we'd like to invite you now to give a few remarks. And I think because Dr. Tedros mentioned the compact and the interesting work that some of the, yourself, Gordon Brown and Tangozi played, because we all used to remember the times of debt relief. And I recall you saying yesterday that, how did we arrive at the point where 25 years ago, we had debt forgiving, we struck oil in most of our countries, we developed the capital markets, and then 25 years later, we are back up in hand again. So clearly, we were not able to sustain the gains that have been made. So Baba, I would like to invite you to lead a round of solidarity messages by telling us why, at your very young age, you are still very hopeful that there is chance for us post-2030.
President Mahama, I understand you have done part of my job before I came in. Thank you very much. You are a good brother. You've always been like that. Your Excellencies, and distinguished ladies and gentlemen, friends, brothers and sisters, let me first of all apologize for coming late. Ngozi, I miss your points, but of course, since I sat by your side and you whispered into my ears what you said, let me begin by thanking President Mahama for his decision in convening this research, and to salute the African Union, the Rockefeller Foundation, Afro Champions, Georgetown University, and all partners who have made this gathering possible. I have sat in many rooms in New York in the past, and here we are again sitting in another room. My hope today is that we live not with slogans, but with solidarity. Solidarity that will work for all of us. When I first held office in the 1970s, the world was turbulent. Debt crises, regional wars, global rivalries, but with some predictability, and there was some degree of structure. The Cold War, for all its dangers, was governed by certain rules. The multilateral system that succeeded the Cold War, though imperfect, provided avenue for dialogue and compromise. Even when painful, there were patterns leaders could navigate. Impunity was or never reared its ugly head. Today, the turbulence is of a different kind. The multilateral system is frayed, unstable to command the trust or compliance it once did. The global aid system is in decline, if not drying up. Stretched, thin, and losing credibility. Geopolitical tensions are rising, with fears of a new Cold War dividing the world into camps that undermine cooperation and solidarity. And these collide with threats that respect no border. Climate change, pandemics, food insecurity, and financial contagion. This is not turbulence we can simply predict or manage with the tools of the past. Crises now intersect, cascade, and accelerate one after another. And it is precisely in this era that solidarity must be redefined, refined, not as charity, but as our sincere insurance policy and common security. I've witnessed solidarity change lives. First, debt issue. At the turn of this century, Africa and several developing countries in Asia and Latin America were drowning in debt. Some countries were spending more on servicing interest payments and debt service than on health and education of their people put together. Along with others, I pressed the case for continent. I pressed the case no continent can grow chained to impossible debts. At that time, world hesitated, but through the Jubilee 2000 campaign, through the G8, through alliances of governments, civil society, and faith leaders, momentum built. Out of that came the HIPIC initiative, and later the Multilateral Debt Relief Initiative. In total, more than $100 billion of debt was cancelled or forgiven for over 30 African countries. That was not an act of charity. It was an act of solidarity and justice. That was solidarity institutionalized, and it worked. Nigeria was a beneficiary under my watch, and I will want to thank Prime Minister Brown. And my indefatigable Minister of Finance, Ngozi Okonjo-Iweala, who worked tirelessly together for Nigeria to benefit as much as we did. Second, the fight against HIV/AIDS. In the late 1990s and early 2000, HIV/AIDS was a devastating threat. There were forecasts of whole economies hollowed out by disease. We pressed the world to act, and I called a summit in Nigeria. Out of that summit came out, from that summit came out the Global Fund. And that's very interesting as aspect of the Global Fund that I should tell. When Kofi Annan came to the summit, he suggested the Global Fund. I looked at the pulse of Nigeria and I put down $10 million for the Global Fund. President Clinton attended, but he couldn't do much until he left office. When President Bush came, he invited me, and with $200 million, he launched the Global Fund at the Rose Garden in the White House. On my way from America, I went through Europe. And leaders in Europe asked me where I was coming from. And I said, America. What did I go there to do? I said, we went to launch the Global Fund for HIV/AIDS. They said, by how much was it launched? By the President of America. I said, by $200 million. They said, go back and tell him that he forgot 1 0 behind it. I did not come back, but that launching raised over $50 billion and saved millions of lives. And that was solidarity. These platforms prove what solidarity could achieve. Maybe I should also add the issue of Ebola. Ebola in 3 West African countries: Liberia, Sierra Leone, and Equatorial Guinea. And we've never had anything like this. I visited the 3 countries, and President Nkrumah told me that, look, we love to respect our dead. So when people died, we woke up in the morning in Freetown, 50 people died overnight. We take care of the dead body and all that, and we didn't know. But at the AU, 100 people were already set aside to try and go to these 3 countries to help. But there was no money. The chairperson of AU then, Madam Zuma, we talked together and we thought we could raise money from the African private sector. And we called on them. And $30 million was raised. And that was used to send AU specialists to the 3 countries that were badly affected by Ebola. Again, solidarity. The lesson is clear. Solidarity is strongest when it is embedded in institutions and mechanisms that endure beyond moods and political cycles. This is why the Accra research matters, because it calls for a new operating logic. As we heard from the panel, we have to think out of the box. And in fact, act out of the box, not just thinking out of the box. There are And these, for me, are in 4 areas, 4 important areas of health, education, food and nutrition security, and climate change. These 4 areas are interconnected, interrelated, and we cannot treat them in silos. We have to treat them together, I believe. We have to look for fund and investment that are safe and secure to replace aid. We must move away from aid dependency. I have raised the issue when these ideas came with public sector people, private sector people, multilateral institutions, and the civil society. I thank Prime Minister Gordon Brown again, because he was one of those I first went to. And you accepted and you agreed to work along with us. I must, of course, especially thank President Mahama. When I came, I remember you said you have a trailer. And I said, I'm not adding another trailer to you. I'm just putting a luggage in your existing trailer. And here we are. I thank both of you for agreeing to be fellow traveler in this new enterprise, if I can call it an enterprise. If we succeed in redefining this process, it then this gathering will not be just another side event in New York during the UN General Assembly. It will be remembered as the moment Africa initiated the Global Solidarity Action, and the world chose solidarity as the only workable path forward for survival and progress. Thank you for listening.
Another round of applause. Baba told me a long time ago when I thought he was talking for too long. He shut me up and he said, when you have age, you have the right to speak. When you have power, you have the right to speak. I have both. So I would like to invite, moving swiftly along on solidarity messages, and we'll plead that we can make it very brief in 2 minutes, and since very enlightened speakers who have the ability to deliver a very good message in a short time, may I invite Prime Minister Gordon Brown to deliver your remarks, please.
Can I first of all thank President Mahama for leading off today. Your support for the health initiative, your work in your own country is something that is recognized not just in the African continent, but in every continent. Thank you for what you are doing. And I want to also say to President Obasanjo, your mention of the word solidarity is what we are talking about today. Just think what we can achieve when we work together. Now, I have thought you were late, President Obasanjo, because of all the many other initiatives you've taken. You are now reorganizing the traffic system in New York, because that is desperately needed. But your initiative on health here is something that will be recognized right around the world. Thank you for everything that you do. The cuts in international aid were savage, they have been sudden, they have been unprecedented, and they're unforgivable. And they've left people starving in many places, dying in other places, and left countries with the burden of debt. And I am prepared with all of you to lead a campaign to relieve that burden of debt, because it is desperately needed. But the option that we now have is to build what we call health sovereignty. African-owned, nationally led, locally delivered healthcare systems, that we build the capacity in Africa not just to produce drugs and to manufacture them, but to deliver healthcare in all its aspects. And I applaud your initiative in Ghana for free primary healthcare, and that must be the model for the future in the whole continent. So I want to congratulate all those who have been involved in this, all those who have been part of the original Accra Compact, Mark Dybel, who has done so much here from Rockefeller, all those who are here today. You know, there are many important meetings taking place in New York today, but this is indeed one of the most important, because what you are setting forth is a plan for the future that can transform healthcare in Africa. And I believe it is a measure of the importance of his initiative that we have so many leaders here today, so many leaders supporting this, and so many on video listening to this today. I welcome everything you've done. Just think what we can achieve when we work together. Thank you.
So I have the privilege of putting another leader on the spot who has just come in time to deliver her solidarity remarks. She was originally scheduled to join us on a panel. She is also, together with President Mahama, the lead advocate for reparations on the continent. I will spare her a few minutes as she gets her act together, and I'll invite the CS of Kenya to come deliver the remarks on behalf of President Ruto. It's the CS Cabinet Secretary of Health delivering remarks on behalf of President Ruto. Thank you.
Your Excellency President Mahama, thank you for your visionary leadership in convening us for this bold and timely initiative. Kenya joins you in embracing the Global Presidential Council to drive forward the Accra Reset. This platform can reimagine how nations collaborate on global health, not as recipients, but as co-authors of a new era in health sovereignty and resilience. On behalf of President William Ruto, I bring greetings from Kenya and reaffirm our unwavering commitment to global solidarity, equity, and innovation in health. Excellencies, distinguished leaders, the current global health architecture is not fit for purpose. COVID-19 exposed and magnified inequities. Africa waited, Africa watched, Africa was left behind. This must never happen again. From that injustice came the determination. The next global health order must be anchored in equity, must be rooted in accountability, and driven by leadership from the South, not merely as implementers, but as vision setters. The time has come to finance our own ambition. The old paradigm of dependency is no longer sustainable. Kenya believes in bold, future-facing models of health financing, from domestic resource mobilization to innovative pooled funds, from catalytic private sector engagements to regional health investment banks. We cannot build resilient health systems on borrowed goodwill. Health must be seen as an investment in productivity, in justice, and in security. When people fall sick, they cannot afford care. The foundation of our social contract is then threatened. And that's why Kenya has today enrolled over 26 million people into a new social health insurance scheme, with the most vulnerable fully subsidized by the state under the primary health care. Our approach is guided by a simple truth. universal health coverage is not a slogan, it is a sovereign obligation. From the remotest community to our referral hospitals, we are building a system that is inclusive, efficient, and digitally powered. Yet health does not exist in a vacuum. Climate change is today's most pervasive health threat, driving hunger, disease, migration, and loss of livelihoods. Kenya supports urgent integration of climate resilience into health planning, from early warning system to green infrastructure. Equally, we must demand a strong global compact on pandemic prevention and preparedness. Pandemic knows no borders, neither should solutions. Kenya calls for a robust regional surveillance, fair access to vaccines and therapeutics, and full support for pandemic treaty and its annex on equity. This is not a charity. It is an enlightenment self-interest. But no health system can stand without its people. We must invest in the workforce, community health promoters, nurses, doctors, and technologists. Kenya has deployed over 100,000 digitally enabled community health promoters because the future of health is anchored at the community. Excellencies, this is our moment to lead. The Global Presidential Council must be a platform for accountability and ambition, where commitments are monitored, financed, and translated into action. Kenya welcomes this shift from a fragmented, reactive model to one that is strategic, South-led, and anchored in shared sovereignty. In closing, let us remember, history does not bend on its own. It bends through the courage of those who dare.
We have messages from Brazil, Indonesia, but since we have Caribbean in person, would invite Her Excellency Mia Motley to leave a very, very brief remarks. Thank you.
Thank you very much, Your Excellency, President of Ghana, Baba, my senior, who has caused me to be here, and he summoned and I appear. Prime Minister Brown, distinguished guests all, let me say that the pathway towards bringing the Caribbean closer to Africa had its modern roots in the last few years on this very issue of healthcare. We are so small that when we make orders, people say, we'll get back to you. And invariably getting back to you means no delivery. We went through a rude awakening during COVID, and that prevented us from being able to do the things that governments take as their duty to protect their citizens. And it was only when Dr. Tedros introduced us to Strive, who was at the time leading the effort for the establishment of the African Medical Supplies Platform, that we were able to get a clear pathway separate from the generosity of the Prime Minister of India. We have, since I came to office in the last 7 years, been able to rely on at least 2 cohorts of nurses from Ghana to keep our health system in Barbados stable. And for the last few years, I've also been leading the One Health Global Initiative, which is intended to enhance awareness with respect to antimicrobial resistance, which is a big fancy set of words for basically working out how we're going to fight infections and whether the antibiotics and the medication that we're using is effective in fighting medication, because it is now responsible for the 3rd largest number of deaths globally. And last year at the UN, we agreed to the political declaration, which at the very least should see a reduction in deaths by at least 10% by the year 2030. There is no issue that has the capacity to bind our people and our governments more than cooperation in healthcare. And I give you those three examples to show you that this is where the rubber hits the road. But I want to leave you with one other. And I'm sorry that Ngozi has left because we've been engaging on this. We need, and we've done the initial paper, for an opt-in South-South alliance with respect to pharmaceuticals, with respect to therapeutics, with respect to machinery. It makes sense because you in Africa have a demographic dividend and you have to find the jobs for the people. We have a demand in the market for the things that we need. Our people have access to technology. Their aspirations and expectations for excellent health care rise accordingly because they know what is out there. And while others who are at the very top of the population look at drugs and mechanisms to lengthening life beyond 100 years old, our people are fighting up with basic public health issues and basic issues related to chronic NCDs. The inequity that potentially exists can drive us further and further and further apart. I make the case for us to align our policies and to align also the reliance on each other to fill the deficits, whether the deficits are skills related, whether the deficits relate to the need for enhanced market opportunities to make pharmaceutical companies or other medical supply companies viable. Whatever it is, we need to use the technology that was used to bring us together when the world faced this modern pandemic to be able to survive. We used it, we came together, and the technology and the policy alignment and the financing arrangements, that's how Afreximbank eventually came to the Caribbean. That is why it now has its one office outside of Africa in Barbados, all because of cooperation in healthcare. So I urge us, and I thank Ghana and Baba for you all ensuring that this is not a flash in the pan, but that the secure foundations necessary to ensure that the SDGs that will require not just us to improve healthcare, but to improve opportunities to fight against poverty. Because if our citizens are not healthy, they're not in a position to fight poverty. And therefore, I commend you. And on behalf of Barbados and whatever influence I have in CARICOM, I say to you, we will walk in lockstep with you because this is what we were elected to do, to make a difference to our people. Thank you.
Mr. President, I believe you have a hard stop at some point, but given that there's such an outpour of solidarity messaging requests, but also there are very amazing people in this room that are so assuming that some of them have been hiding. I thought I should use just 1 minute to acknowledge some of them who are doing amazing work and who hopefully we might be able to persuade to join your College of Advisors. So I see Dr. Senait Fiseha, who is hiding behind you. She's the head of global programs for Buffett Foundation, doing extremely amazing work in sexual and reproductive health inequities. I do recall seeing Peter Sands. Is he still here? Peter, do you want to stand? We'll send a mic to you and say a few words. Well, let's start with Senait.
Thank you, Excellency. It's fantastic to be here. I'm sorry I missed the Accra meeting, but it's just so extraordinary to see our continent taking leadership. I sound like a broken record because prior to the recent events of turn of events in global development, I have been calling and pleading and begging the development landscape. I see Bruce right across, and he and I have spent a lot of times during ANGA saying this needs to change. Africa cannot just continue to beg. So to see this paradigm, I know we're being forced to deal with this, but I think out of this is going to be born a time where we not only say the mantra going around continental leadership, Africa first, but actually our leaders' action will actually meet their words, and there will be accountability, and then there's no shortage of talent in the continent, but it's opportunity that we lack. So hearing from Mia, the work we've done through HEDPAC, bringing Africa and the Caribbean together, I really do see an incredible bright future and possibility, and stand in solidarity to absolutely support this initiative. Thank you.
1 minute, and then this Gabi still here, Dr. Nishta? Okay.
Thank you, and my thanks to His Excellency for convening us. The Global Fund has been privileged to be a partner to Africa in the fight to improve health for the last 23 years. For most countries in the continent, we are the largest multilateral provider of external funding for health, and we're extraordinarily proud of the work we've done together to reduce mortality, to save lives, to strengthen health systems. As His Excellency President Obasanjo said, the Global Fund is a very powerful demonstration of solidarity in action. The imperative to accelerate progress towards fully nationally led, nationally owned systems for health, no longer reliant on external support, is absolutely clear. But this is a journey, it's not a switch. Too abrupt a transition will derail progress, will leave people behind, will cost lives. We see our role as the Global Fund as being a trusted partner on this journey, an enabler, a supporter, but ultimately a friend that knows when to get out of the way. To play this role, I wouldn't be doing my job if I didn't remind you that we too need resources. We are in the process of our 8th replenishment. His Excellency President Ramaphosa and Prime Minister Starmer are co-hosting this replenishment, which will culminate on the 21st of November on the eve of the G20 summit. It's important to note, replenishing the Global Fund is not about perpetuating the old model. It's providing a bridge to the new. It's a rung on the reset. So we applaud the reset. We're committed to playing our part in making it happen. Thank you.
And Accra Reset will send you a check for free advertising. We'd like to invite, on behalf of ministers, Mr. Pate, and then Gavi, and then now we will invite the president. What we've decided to do now is we'll no longer have a part 2. We'll unpack that in another configuration. We'll just focus on the solidarity remarks that speak by the president. Mr. President, you also have your constituency here. The Alliance of African Multilateral Financial Institutions are here. So we might be able to, they are willing to make pledges about resources. There's a Confederation of India Industries also, their president is here, and they all want to support this global initiative and commit resources and pledges. So, Pate, we're going to just take 1 minute. You can look at the clock, and when it goes on 1 minute...
It'll be 30 seconds. Your Excellency, Mr. President, John Mahama, Baba, President Obasanjo, Prime Minister Motley, Prime Minister Gordon Brown, other excellencies and honorable ministers. I think for us as ministers from the African continent, but also from countries that are friends of Africa across the Caribbean, Latin America, Asia, all over the world, I think this is welcome. This leadership demonstrated by President Mahama and all our heads of state is really wonderful. And for us, we take our marching orders. The work starts at home. We work in solidarity. We work hand in hand. We work to deliver with the resources that are available. And we thank Prime Minister Gordon Brown on the debt issue, because that relieves at least some of the fiscal challenges that many of our countries are facing. For us ministers and all our executives, we'll just take it forward. The private sector is also here. Let's join in. I think this leadership is amazing. It's transformational, and we thank you, our leaders, and we'll just move on and get it done. Thank you.
Thank you. Nados, can you stand so everybody can see you? We have Nados also in the house. We're not going to give her the mic, otherwise she would. So Nados is the Chief Executive of Outer NEPAD. Nados, thanks for coming. And so now I'll move to Gavi, Dr. Nishta.
Good evening, everyone. Your Excellency President John Mahama and your colleagues who have supported you in this initiative. I just want to say that at Gavi, we are extremely supportive of the Accra Reset initiative because this is very opportune, it's needed, it's timely. We are at a moment in the history of international development where we risk a disorderly collapse of what has been structured over the last several decades. And we as an individual entities are downsizing, we are reshaping, we are streamlining, but there is lack of an overarching initiative to bring us all together. So there's clearly a need to set objectives, be clear about the scope, define a process, outline the leadership, and define what success would look like. Because this is an unprecedented opportunity, not only to do away with duplication, fragmentation, mission creeps, and overlaps, unnecessary overlaps at the global level. It is also an opportunity to truly create a global health system, not global health institutions, but truly a global health system and an ecosystem which will support national priorities, which will stand behind national plans, and that will truly deliver for disadvantaged populations on the ground. So we want to thank you for bringing us all together. And at Gavi, we want to commend you for this effort. And I just want to reiterate that we're very supportive of it.
So as I bring the president to give the keynote, I'd like a few people to just stand quickly. Is Jeffrey Stark still here, or did he leave? Okay, he's gone, okay. Ike gone? Ike is still here. So Ike, would you be gracious enough to stand? Where's Confederation of India? Is Babajide still here from AMFI? AMFI is the Alliance of African Multilateral Financial Institutions. So can we put a mic to your to tell us how much you're going to invest very quickly in opportunities that are being created by Accra Reset? Because we can't depend on loans and aid anymore. So what are you willing to invest?
Your Excellencies, particularly our co-conveners, President Mahama and past President Obasanjo. The spirit and soul of humanity is solidarity. And as an African, I am so proud to feel the power, the energy in this room coming from the private sector, the public sector, the North, the South, indeed, almost literally all stakeholders are well represented here, even though I want more of the voice of the youth to also be represented in this journey. There is one thing that financial institutions do, and that is they do not act on the spur of the moment. I did notice that when President Obasanjo was speaking of the 4 challenges, he said climate change. He didn't look at anybody. He said health. He didn't look at anybody. When he said financial contagion, he looked at me. And so, with my risk manager's hat on, I will beg to have the opportunity to consult, of course, with those I must consult with, my board, and so on, before I make a pledge. But more importantly, I do take on the responsibility of being your flag bearer and voice in the financial community, because we shall not be coming alone. Thank you for putting me on the spot, but it's actually an honor and privilege, and certainly we will be one of the very serious pledges. God bless.
May I now finally bring His Excellency, allow you to help me present to you as I introduce His Excellency, the President of the Republic of Ghana, the African Union Champion for Financial Institutions, to deliver what will be a keynote remarks, but also the closing remarks. And after that, I'll invite my brother Victor to give some remarks, and then we'll have a photo opportunity as well. Thank you, Your Excellency.
Thank you very much. Adam has done such a good job introducing everybody, and so I'm not going to acknowledge it. I'll just go straight. I just want to make 2 quick notes. Tomorrow, we have a side event on African financial institutions, and so there's a direct link between what we're doing today and what is going to happen tomorrow. So as many of you who can should join us. I also want to agree with what Peter said, that this is a process, it's not an event. And so we're in for the long haul. And so let us work together in solidarity to see our objectives realized. I'll just read this to put it on record. It's an honor to address you today at this historic gathering. Allow me to begin by warmly welcoming you and expressing my sincere appreciation for your dedication to the cause of development and global solidarity. Only weeks ago in Accra, Ghana, we convened the Africa Health Sovereignty Summit. Leaders from across Africa and the wider world, including Presidents Obasanjo and Ellen Johnson Sirleaf, the Global Director for the World Health Organization, Tedros, representatives of the African Union, development finance institutions, ministers, business leaders, and civil society joined us to chart a new course. I want to extend my heartfelt gratitude to all who found time to come to Accra and who lent their voices and vision and who helped us launch what is now becoming a global agenda. As African Union champion for African financial institutions, I carry a mandate to help shape the future of our continent's financial architecture. As a continent's advocate for reparations, I am also deeply aware of the failings of the world's moral order. That responsibility is also why I'm passionate about the Accra Reset. For I know that without new governance, business and financing models for development, there can be no sustainable path for health, no resilience for our economies, and no workable future for global solidarity. That summit produced a resounding consensus. The health crisis we face is not only a crisis of disease, vaccines, and hospitals, but also a crisis of social and economic inequality. It is a symptom of a deeper malaise in the global development architecture itself. The collapse of the legacy aid system, punishing debt burdens in the global south, and fragmented supply chains are not isolated problems. The evidence that the very logic of global development as we have known it is no longer fit for purpose. From Accra, a message went out to the world. If we are to heal our health systems, we must first reset development itself. Excellencies, we meet here in New York at a time of increasing global uncertainty. Humanity has made progress once unimaginable. In 1990, 36% of the world lived in extreme poverty. By 2019, that figure had fallen to 8%. Global life expectancy has risen by nearly a decade in just one generation. Maternal mortality has declined by a third since the year 2000. In global health, since 2000 alone, more than 50 million lives have been saved through expanded access to vaccines, HIV treatment, and malaria prevention. The Global Fund and Gavi, born out of a new development consensus 2 decades ago, have provided life-saving tools to billions of the world's population. This progress deserves recognition. It reminds us of what becomes possible when global solidarity rises to meet global challenges. And yet, even as we celebrate these gains, the cracks in the global order are growing deeper. The question that agitates our mind is, how do we sustain these gains in the face of current global shifts? The COVID-19 pandemic erased 2 decades of poverty reduction in less than 2 years. Climate change has driven nearly 735 million people back into chronic hunger. Almost one in 10 of the world's population is facing chronic hunger. Developing countries now spend more on servicing external debt than they do on healthcare and education combined. Africa's external debt stock alone exceeds $1 trillion in 2023, with debt service consuming nearly 1/5 of government revenues in many African countries. The MDGs and SDGs have been the lodestar of global ambition. The MDGs lifted over 1 billion people out of poverty. The SDGs galvanized unprecedented cooperation. However, the UN's own 2023 report indicates that fewer than half of the 169 SDG targets are on track. In health, in inequality, and in fiscal resilience, the situation is particularly dire. The temptation will be to prepare another catalog of partnership global targeting. ODA is declining, and there's reportedly an overall 40% reduction in worldwide humanitarian assistance. We need to strategize. The world needs a reset, a re-engineering of the very logic of development itself. And this is the vision of the Accra Reset, to rebuild global development around sovereignty, workability, and shared value. To make it possible to co-invest, co-design, and co-create for shared priorities. Health, long the most aid-dependent sector, is our proof of concept. Through the sustained framework, the 4D innovations platforms such as Panabios, Prosper, and the African Continental Free Trade Area Hub, now augmented by the Health Investment Multiplier and Synergy tools, along with a new global health architecture and governance framework, we're pioneering models that move from dependency to sovereignty. Already more than $1 billion in reset-compatible pledges from African development finance institutions and private banks have been aligned with a new approach through the pooled pledge and deal rooms arrangements. And while we launch this reset today, let us acknowledge that others have already been at work. From President Paul Kagame's leadership under the Lusaka Agenda to the Africa CDC and the African Medicines Agency, proving that sovereignty-led models are not only possible, but practical. Working together, we will not only sustain these gains, but also expand them and utilize them to protect the well-being of our people. But health is only the beginning. Africa is only our starting point. The reset looks beyond today's crisis and identifies new pivots of growth: biodiversity, climate resilience, nutrition, and empowerment economies. These are not only moral imperatives, but trillion-dollar opportunities for inclusive, climate-positive prosperity. The IMF estimates that emerging markets and developing economies will require $2.5 trillion annually in climate finance by 2030. Without new governance, business finance models, these needs will remain unmet. And so we must move from vision to operating models. The reset is anchored on 3 fundamental shifts. The first is a mindset shift. This is needed, recognizing that we live in an era of unpredictability. The post-war multilateral era is being ripped apart. It appears we must prepare for a period of global turbulence. The second is a focus shift, moving from beyond crafting new lists of global goals to building executable business models for coalitions, syndicates, and platforms that deliver. And the third is a reality shift, accepting that diverse, even contradictory interests are now a permanent feature of our system. And turning these very tensions into the fuel for pragmatic cooperation and mutual investment is imperative. This new model demands resource multiplication and not rationing. Instead of limiting resilience, let us multiply it. Instead of setting new spending targets, let us measure the additional value that health, climate resilience, and food security can contribute to the global economy. To give this reset shape, we must launch a new global coalition, a partnership of the willing, the beginnings of a durable club, a presidential council comprising heads of state and government from Africa, Asia, Latin America, and beyond, which will provide political leadership to this movement. A high-level panel drawing from health, finance, innovation, and business will provide intellectual depth and evidence to this exercise. Together, this coalition will apply the operating logic of the reset to help the world rethink global development itself. It will work collaboratively with the United Nations, with regional institutions, and with the private sector to drive global thought leadership, while also serving as a platform to test and refine the new models we're looking at. Health will be our first ground of experimentation, but the lessons learned will be shared across all sectors, from climate resilience to nutrition to empowerment of our economies. In doing so, we'll drive sector strategy labs and pioneer the spirit of workability. We are discussing geostrategic deal rooms to facilitate risk sharing, investment in health, climate, food security, and job creation. But our mission goes further. It will help shape the post-SDG agenda. The world is only 5 years away from 2030. And the question is not simply what new targets should replace the SDGs, but how we design institutions and financing systems that can actually deliver. This means thinking outside the box, about new and innovative financing instruments, about fresh business models, and about smarter coalitions that multiply rather than ration resources. The Presidential Council and the high-level panel will help the world confront big questions. How do we govern in a poly-crisis era, where shocks are a permanent feature of our daily lives? How do we unlock trillions in climate finance without drowning countries in debt? How do we turn sovereignty into a multiplier of value rather than a barrier to cooperation? These are the challenges that the Accra Reset seeks to address, and the eminent minds and hearts gathered here today will be the driving force behind creating designs and executing solutions. I want to take the opportunity to thank the many leaders in Africa, Asia, Latin America, and the Caribbean, as well as our partners in the West, alongside business leaders, global multilateral institutions who have already welcomed this initiative and are collaborating to make it a success. Their support affirms that the reset is not only African in its origins, but global in its reach and its relevance. It is indeed right that the Global South should take the lead, for it is in our countries that the collapse of the old world model will be felt most acutely. And it is from our innovations that the world can find new answers and solutions. The reset is not a rejection of what has been achieved. It is the next phase of global development. Africa's invitation is to co-create a new operating system for world progress. The last major attempt to reset global development came with the Monterrey Consensus in 2001. For the first time, multilateralism formally shifted from a paternalistic approach to a partnership-based one. Health was at the forefront of this effort. Faced with HIV/AIDS crisis, African leaders like Kofi Annan and Olusegun Obasanjo galvanized the world. Their leadership produced enduring institutions such as the Global Fund to fight AIDS, tuberculosis, and malaria, and Gavi, the Vaccine Alliance, which were designed to embody the Monterrey principles in their governance and implementation. Much good was achieved and millions of lives were saved. The world again faces a choice, a crisis or reset. And just as Montero sought to re-engineer development 25 years ago, today's fragility calls for a new vision of global multilateralism. Health is once again at the forefront of this transformation, like it was then. It is the sector that is most exposed to the failures of aid dependency, but also the sector best positioned to provide sovereignty-led models that can succeed. We call on governments, innovators, financiers, and civil society to join this movement, to move from catalogs of need to engines of value creation, to redeem the promise of development for the post-SDG era. In conclusion, history will ask whether this generation, in the face of crisis, rose to the occasion. And I believe that we can summon the same courage that people like Kofi Annan and Olusegun Obasanjo and other world leaders mastered when they mobilized the world against HIV and AIDS. And so let us channel that same spirit today, not only for health, but for financing and strategizing development itself in a fractured but yet still interdependent world. Let this be a positive turning point where we rise as partners and take our destiny into our own hands for the present and future generations of the world. I thank you.
One more round of applause. I guess we don't need any more things to say. There's nothing else to be said. We have our marching orders. And so I'd like to invite my brother Victor to sort of give us the next steps. But in doing that, I'd like to also thank and acknowledge the governor of Bayelsa State and Senator Donyedri, governor of Bayelsa State, and Senator Sunday Mashak Kutunde, who have been here with us from the beginning, and all the amazing friends and colleagues who have all come to give us support. Thank you very much. We also have a report of the Accra Compact that is available, so if you don't have a copy, please grab a copy. Thank you very much, Ebere.
Thank you very much, Adam. Your Excellency, President Mahama, Excellencies, ladies and gentlemen, my task is very simple. As Adam said, a lot has been said already, so I will not belabor the point. Just wanted to say that it's an honor to close this gathering with deep appreciation for your reflections, your thoughts, and your commitments. Only weeks ago in Accra, leaders from across Africa and the world joined to affirm sovereignty as the foundation of health and development. Today in New York, we have carried that message forward. Our task is now very clear. The Accra Reset challenges us to do three things. Number one, to sustain the gains by rooting reforms in national systems and accountable budgets. Number two, to defend the gains by reshaping global governance so Africa and the Global South help design, not just receive, solutions. And number three, to grow the gains through innovation and evidence-based solutions that multiply impact. Your Excellency, today you've also spoken about and launched the Presidential Council and the high-level panel, new platforms to transform vision into delivery, ensuring leadership, accountability, and shared responsibility. Excellencies, the reset is not just another declaration. It is Africa's invitation to co-create a workable system for global solidarity. Its credibility will be measured not by promises but by proof in financing, in governance, and in the lives of our people. Let us leave this room determined to build a future that is sovereign, workable, and accountable. I want us to reflect on a few things that His Excellency the President said, and some quotes from Accra as we bring this to a close. Your Excellency, you talked about the three bits of the revolution, the mindset shift, the focus shift, and the reality shift. I also wanted to remind us of three quotes that came out of Accra. And I'll quote El Haj C, who in Accra said that too many promises have been made, too many promises have been broken. Let us not break any more promises. I want to quote my brother, Ahmed, you know I would come to you. Ogwell. He said, what went on in Accra must not stay in Accra. And I want to say, what has gone on in New York must not stay in New York. And finally, I think Dr. Tedros also said something very profound in Accra. He said the difference between crisis and opportunity is leadership. Your Excellency, you've shown remarkable leadership. And we hope that this will not be the end. This will be the marching orders for us to do something even greater for our countries and for the world. Thank you all very much.
So now to the photo opportunity. So I would like to, as they clear the place for us to take the photos. The photos are going to be first the president and the conveners and former presidents. Then we'll have the president with ministers, and then with partners, and then with all of us. Okay, so it's going to be very quick. Mr. President, there was
come with me.
As we are getting the place organized, Shusita, Mr. President, I was told that we were, yeah. Are we ready? Yeah. So, another Prof, do you want to call? Nados, the co-conveners and partners from Accra, did Gordon Brown leave? Okay. All right. Okay, Naveen? Yeah. Mark? Okay. Peter Sands, yes. Global Fund was a partner in Accra as well. Okay. And Mr. Gavi? Magda? Yes, John. Yes. No.
You are. Thank you very much.